Welcome back to VCK's podcast as we continue this conversation. It's a very insightful conversation as you've had. And I'd like to also welcome you to share your comments and contributions to these conversations through our chat box. You can just send us a text, say maybe what your experience is in terms of accessing health services in any health facility, especially a public facility in Kenya, and also were you assisted or what challenge you faced, and how best can we also better these services as a country. Before we took a break, we were talking about, I think this was something that you talked about maybe in the course of the break, concerning just service delivery still. Talking about medics in Kenya who also run private practices, do you think they also contribute to maybe some of the issues and challenges we face as Kenyan citizens when we want to acquire services? Because there have been instances where someone goes to the hospital and they need maybe a lab tech, but the lab technician is not around, so they can't still get the services. Ama they need to see a doctor, the doctor is not present. They need to see a pediatrician, the pediatrician is not present. But at that particular time, it's not that the pediatrician is not at work that particular day, it's because they're running their private practice. So you as healthcare worker in Kenya, what do you think about it? Do you think it's something that benefits us as a country, more so the low-income earners in Kenya, or rather any person that is seeking services from a public health facility?
I must say that it's not benefiting Kenyans because you find that if you work in a private facility, maybe you work there the whole day, or perhaps you work also, you work during daytime and as well at night. So when you work the whole night, or you have a procedure to conduct during night at your private facility, the following day you will be fatigued, so you will not be able to offer your services well. So I think what the government needs to do is maybe perhaps start paying their healthcare workers well, so that they cannot have an option of also running their private facilities. Because you'll find that even the nurses that are currently in Kenya are few, because most people prefer to go work in more developed countries because of the good package they'll get from those other countries, as opposed to what they're paid in Kenya.
Oh, okay. Wanja, do you think that also contributes to service delivery? Ama you think it's okay for healthcare workers to have their own private practice and practice during working hours?
Mi naweza sema tu, I think for me naweza sema one of my favorite and I think one of the other speakers in the podcast alikuwa nasema ati government inafaa kukupea chakula. Nilikuwa tunacheka, but that person was making a lot of sense, because Article 43 is telling me that I need to have some access to, housing, a decent housing. So it speaks to those issues of why are there people who are living in a place that is not without sewer line. In Nairobi, in other countries, balconies are meant for sitting, enjoying. In Kenya, in Nairobi, balconies are for mutungis, and they are orange, yellow mutungis. They haribu like where I live, the landlord has made a tank ya juu na ya chini. Now one of the small one, he told me, ni asazire ya kusha vimo ile kadogo tu. It has spoiled the whole aesthetic of the balcony, because when you go to TikTok, you see the Gen Zs, how they make the balcony, they decorate. But here I have to contend with a big, ugly black tank, hawezi decorate, iko tu imehang. What I'm saying, for me, is that your average Kenyan is entitled to Article 43 rights. Na hiyo ya health, hapo kwa health wanasemanga, highest attainable standards of healthcare. Highest attainable standards of healthcare. Ati huyo mtu akikufa, tumejaribu na yeye juu chini kulia kushoto, including reproductive care. Na sasa, if we also having a country where mtu anaogopa kwenda hospitali juu hana pesa za kulipa, huyo mtu enjoy highest attainable standards of health. But the reason why mimi nateteanga public health kwa public facility, tuseme tu tumekaa hivi sasa. If you take someone to a high-end private hospital, mtamua mlipe deposit kwanza. So public facilities, public education, public everything, it is the last resort and the most common denominator sisi wote. And people think that public facilities are for the poor. There is something, and I am talking about this subject with a lot of sensitivity. The former Nyeri governor mwenye alikufanga kwa accident, with a lot of sensitivity to his family, I also remember that after your accident and your situation, the hospital that was nearest him is Thika Level 5 Hospital. Thika Level 5 Hospital is like what is Kenyatta is. What it is to Thika is what Kenyatta is to a neighboring community, Kibera, what. So inamaanisha, regardless of high economic means, in situations where you meet an accident, emergency care, before tufikiria ati unahitaji ukona a personal doctor in high-end facilities, you end up in a local private hospital near you. When the KU students walipatanga accident, wote kwanza tuwapeleke Voi. So hapa kunanga debate ya we uko high class or not, una bleed. Una bleed. So tunataka uache kubleed. After hapo tutaongea. If we'll talk about lifting, hizo ni vitu za after umeacha kubleed. Otherwise wewe na death, almost same WhatsApp group. So for me, what I'm saying is that I find that kuna kuangana kale kakituka, you're seeking for public health services hata za shule ni kama ya low income people. So people who can afford private care wako distant ama wako uninterested na hiyo subject juu mimi niko na insurance. You are forgetting that hata hizi mashule za Kenya unaonanga watoto wengi wameenda private because you can pay more. Wakifika Saturday ama grade 9, sisi wote tena tunalia tukiwatafutia public secondary schools. So for me, I feel like if we really want to have highest attainable standards of health, we should make it so much within reach that, you know, the other day I was having a cold. I live near, there's 2 public clinics za government near me. Niliamka tu nikaenda, not because of anything, ni ile part of the walk. It's not, I had a choice really. Unajua ile unatembea alafu unasema utapitia. As in many cases wanakutibu, wanakuangalia nini. But there's also that aspect ya hakuna dawa. So you notice that in most, even for the many Kenyans, inakuanga ni kama yes umeaccess ile public health almost free, lakini ukiandikiwa tu vitu vingine kwa karatasi, uto tuna need a private. There's a place in Upper Hill. Maybe I won't mention siwajui vizuri, lakini when I was there, somewhere tu in Upper Hill, unaona tu watu wanatembea na mafiles, wanaenda na scannings, cancer vitu, you know the place. So nilijiuliza, sasa mtu mwenye maybe hawana pesa, and we know that there's a big facility hapo akina Kenyatta ziko tu hapo, inamaanisha sasa umeambiwa enda ukapigwa x-ray, enda hii place. Unajua hizi vitu za, if we really want to talk about inequalities, unajikutanga people will tell you, ukiongea na watu watakwambia mimi nilienda hospitali A ya government, daktari akaniambia niende hospitali B lakini specific B. So unapata mimi naweza enda x-ray nipigiwe pahali town bora imepewa certification nilipe 2,000, lakini juu niliambiwa enda place B nitalipa 4,000. So you also find that maybe the owners of those facilities, maybe some people in the public facilities wako na economic interest na some facilities. So unaona wewe uko na nguvu ya kubishana daktari, they are handwriting yao hata hatuwezi ona, tuanze hapo. Sasa utaanza tena kumwambia we daktari mimi si niende hivi, anasema tu go to specific this. So for me I think as a country, if you are talking about development, nimekuwa nikiona our president amekuwa akiongea kuhusu housing, what we are so obsessed with infrastructure, manyumba. Lakini the most important thing for me in any country, hata ukienda hizi countries zingine, that's why people are always in training, ni human capital. Watu wagonjwa, now we are talking about mental health ya emergency na youth. That person afai kukutana na barriers zingine, already akona mashida. So one of the things sasa huwa inamaliza mtu motivation ni ukienda hapa unamwenda upigwe picha town, enda upigwe makojo sijui wapi, hiyo kuzunguka. For me I feel like it doesn't make the Kenyans happy.
But again, you know, like I said earlier on, there are some of the services that are not offered in some as per the level of the facility. So like maybe perhaps you can come to Kariobangi, most definitely you will be referred for an x-ray because they don't do x-ray at Kariobangi Health Center. So, and also you are suggesting that we do away with the private facilities.
Not necessarily doing away, but I think we can have a certain regulation. Because there's no way, Arthur, you could be working at a public facility for 5 hours, then you go to your private practice and work for 8 hours. You see, you're already robbing off the government and the Kenyan people time. That's okay.
But,
so
but you see, in as much as they work in those private facilities, they cannot work there for 8 or 5 hours. Like, I believe even your personal doctor, you'll have to book, because you cannot find him at the facility all the time. So again, the reason again as why we can't do away with the private facilities is because of the high number of unemployment rate in Kenya. We have so many graduates, nurses, doctors who are also employed in those private facilities. So in a way, it's also contributing to.
Yeah, we can't. Yeah, I support us not doing away with the private practice. That is something that can never happen. But also, let's not have a practice that devoids the Kenyan citizens of the attention of their doctors and their rights. It's possible for them to coexist. It's possible for us to say that the government is employing me for 3 days, 2 days, I'm able to run my private practice, or vice versa. So again, with that, there is a bit more of structure. We understand, yes, Dr. Wanja works at Upper Hill, but we can find her at Mbagathi, we can find her at KNH, we can find her at Plex XYZ, this day, this day, this day. You understand? Because again, if it's on rotational basis, things will work and things will move. So that as I go to that public facility, I'm not here wondering, daktari alienda wapi? Na daktari leo hayuko? Na even ndio unajua zile conversation, I don't know if you guys have experienced this. You ask, I'm here, I need to see the doctor, and you're told daktari leo hayuko. End of story. Sasa we na ugonjwa wako ujipange, sijui utapona, sijui utatafuta daktari mwingine, but remember tu daktari leo hayuko. Are there explanations to it? No. And you can't tell me that the government does not have resources to put those doctors in place. If we can have money going to churches and being returned, if we can have money to go and Barizi and Sijui benchmark wherever places out of the country and come back, that means we have money, but the allocation of these resources is now what is a challenge. Our priorities as a country are a challenge. So we need to also work around that to ensure that we are putting ourselves together, we are putting our house in order. Yeah.
Actually, to reiterate on that, I think it's misplaced priority, because you find that most private facilities are doing way better than public facilities, because the public facilities are not well equipped. So that will force you to go and seek for the services at the private facility.
You talked about the health facility in Kariobangi being a level 3.
Yeah.
Do you have all equipment that are needful for a level 3 hospital?
Actually, no, because even a level 3 should be offering delivery services, but then you find there's no maternity wing at Kariobangi Health Center, but I'm glad it is under construction right now. Same as Kariobangi Health Center as well as Dandora Health Center.
How many health centers are within Kariobangi?
No, we only have one. For government is only one. We have one, and also we have a level 5 Mama Margaret over Kenyatta.
The newly constructed one.
Actually,
Newly per se, but yeah.
the one that was taken over by the county. Yeah, initially it was run by KNH. Yeah.
So you see, the reason as I'm asking about the level of the hospital that you work in is because at times now if there are no equipment, then why are we naming hospitals? Because if I have the information that level 3 I'm able to come and access maternity services, then I come there and I'm told we don't have maternity services. Why isn't the government working towards ensuring that by the time we're giving recognition of this facility as XYZ, it has the necessary equipment, the necessary number of medics to be able to take care of the patients in this particular region? So those are some of the things that honestly really annoy me at the end of the day. So you just call it a dispensary, but if it doesn't have all the required facilities and medics, why are we putting names to things that don't really matter, yet the common mwananchi is coming here to access services? Wanja,
maybe Joy, if I could say something. You know, to access health is an ecosystem. Unakakanga hivi, kama to the other day, I'm going to meet a relative. Akaniambia, niko ka clinic nyingine in a certain mall hapo juu. Akaniambia kuja ukae kwa lobby. Kwa hiyo tu harakati nikaona pale inaitwa triage. Sasa ndani ya triage kwanza nikajipima kilo. Sasa conversation ya BMI ikaanza hapo. So hivyo tu ndio unakaanga like there's a time I went to a certain Catholic church led or rather zile za Catholic church. Nimekaa tu hapo na goja something. Nikaona tu one of the nurses or the hospital person tena ameita wamama. Hata sisi wenye tumekuja na vitu zetu tofauti, anasema tafadhali wamama na waomba dakika 5 ya masikio yenu, akaanza kutufunza family planning. So unaona ni kwa sababu kuna sometimes you see the problem with health, watu wanadhani ati sasa juu unakohoa hiyo tu ndo kitu imenileta. Lakini kukakuwa na ecosystem yenyewe, kuna mtu anadeal na mambo ya watoto. So anaweza kuja na kama microphone. Sisi tu wenye tunagonjeka hiyo ugonjwa. Anaongea sasa mambo ya nutrition. Huyo wa family plan anaongea HIV and AIDS au other diseases. So for me I think one of the things about our hospitals ni kukosa hako ka ecosystem kenye such a place, you know, our healthcare system should respond to the needs of the people. Unaona for example venye like maybe this year ikianza there was a very, which I think it was a good judicial ruling, wakasema they have decriminalized attempted suicide, and the judge was very wise, akasema people with mental health issues should not be taken to the criminal system, they should be taken to the health system. Niliuliza WhatsApp group ingine aje. Yes, watu wamesema oh thank God, thank judiciary. Lakini kasema kama Ministry of Health inaweza kuwa na ile wisdom ya kudeal na vitu, that is when they should have publicized their mental health awareness, mental health numbers, mental health options. Si watu wako hapo. Si hao mayouth wanafurahi kwa internet. Then it was incumbent upon wenye wanadeal na Nairobi waseme, if you are youth in Nairobi with mental health issues, these are the clinics that offer mental health issues in Nairobi. So unaona ingetae na judiciary venye imesema. So sasa judiciary inasema youth hata mkiattempt sio criminal, lakini hatujaambiwa mwenye akona hizo mashida anafaa kwenda wapi. So you realize even like me, I was like, this is good news because of maybe my interest in the legal issue. However, the most practical thing is if there is such a youth in Mathare, nafaa kwa WhatsApp group ile niko nayo ya my youth leaders, nafaa kusema by the way there was this is really big, this is what you should seek services. So Ministry of Health missed a very important national conversation, probably because of poor planning, probably because of lack of interest in tapping into new issues like new media, venye youth wamefurahi. You know, you should meet people where they are. Usianze tena ati ndani ya clinic ndio umeweka maposters. Hapana, that posters can be made into an online copy. Maybe we could put a gender perspective to this health issue. Hospitali yenyewe unaonanga tu mama na watoto. Wababa wanaenda saa zile amekohoa, ameshindwa kutembea, amejikaza tu. Jikaza kimwanaume, you are a man, you are a man. Wamama ndio wanashinda kwa kutembea na watoto ni. So even issues of language and the dignity. And maybe we are really coming towards probably the solutions. Mimi nasema kitu ya kwanza, I've always said it's a software and an attitude issue. Kwa sababu there are people even with all the best resources lakini hawazitumii poa. You know, sometimes you listen to conversations hadi unasema enyewe kukua poa si kitu poa. As in, ushisikia tu like unaenda YouTube unaona influencers venye mtu anazaa, yani ameingia kwa hii room kama hii, a lot of dignity. Unaona amepewa fruits, ako overfed, yani unaona hiyo atmosphere. And then unaenda places zingine. Mimi nurse, like another lady alikuwa na share kwa podcast, and alikuwa na share ati mimi unajua she was a teenage pregnant and she was ignorant. So unaona by the time sama kwa 18-19 in a health system yenye inatai vitu, inafaa kuona kasichana kako na mimba imtafutie kanas kenye kanajua mental health na kufurahisha yako, kwanza kaanze kukua cancelled juu clueless. So anasema ati how she got pregnant, alafu akaenda kwa hospital, sitaitaja but ni hizi tu za Kenya za Nairobi za government. Sasa yeye hata ajui, unajua venye daktari wanapima mtu centimeter, sijui venye mtu upima, lakini anasema ati wakaanza kuniingiza gloves. Akaambia daktari, yani yeye ameshtuka, Jesus in Christ. So venye alianza kuweko hivi, do you know what aliambia daktari? Okay, inakaa funny but it tells you the ignorance. Aliambia okay, the lady get pregnant, ile teenage pregnancy ya 17 kienda 18. So according to her it was her first romantic sexual encounter with a boyfriend. akaambia daktari, wewe usiniweke vidole, wacha mimi nijiweke nikuambie kupima centimeters. Akaambia, wewe madam, sasa unaona ni mtu mwenye ajui. Alafu akasema ati hata nilikuwa nimejiweka nikasikia kichwa ya mtoto. Sasa unaona mtu biology yake kwanza hatuko pamoja. Alafu daktari akamwambia, wewe msichana usinisumbue. Akamslap, alafu akamwambia, mahali ulipata mimba kwa mdogo, hapo ndio story yako ilisha. Buka vizuri. Unaona huyo mtu amepigwa trauma juu aelewi exactly. Unajua mtu aelewi nini tunafanya ndani ya hiyo situation, hata kujipima centimeter. So for me, I think our healthcare system first should dignify people. Even poor people deserve dignity. The fact that we see women having a good time in private facility, aongeleshwe vibaya, aulizwe ulitoa hiyo mimba wapi wewe, but in public health centers there is a lot of those things. I think we just have to dignify people and to talk to them well.
But maybe perhaps if I would say something, like in Nairobi County, one of the pillars of Sakaja's manifesto was dignity. So, and again, there's poor health-seeking behavior. Look, like if you are working in a health facility, maybe perhaps you're a nurse, there's no way you'll know people, all the community members who are having mental issues or other mental health issues, not unless if they come to the facility. And I must say that we have the community health promoters who are attached to various households at the household level, who are also able to identify such cases and refer them to the health facility. And again, there's always before at the triage, most of the times you'll find the nurses or even the community health promoters at the facility who are all giving health education prior to offering services. So I think maybe perhaps if the government could employ more healthcare workers, because you find that maybe perhaps you're in a facility but you're few, so there's some of the services like that you might bypass, like what she was talking about, offering health education. Like that little girl was supposed to be, maybe she was supposed to be told prior, because that was her first pregnancy, what is expected of her.
Yeah, I also got shocked when I got pregnant. There's so many things as they are unfolding. That's when I'm like, Kwani, this happens. Yes, it happens. So I think also, as she's saying, there's a lot of information that needs to be put out there, even to our patients in general. Anyone who gets to access the premises, let there be conversations that are ongoing to just handle matters from diabetes, pressure, pregnancy, childcare, and all these kind of things. Because again, no one is born knowing, and we can't all know everything. You might think you know. By the way, I used to think I know matters pregnancy and childbirth, up until it got to me and I realized, oh, I don't have any information. And also part of the recommendations we could be having as we close this conversation, we are well aware that it's a devolved function. Do you think it needs to get back to the national government, or should it remain as a devolved function? Because at this particular point, while it looks like it's working, but we are seeing the challenges very evident day in, day out. But however, do you think if it gets back to the national government, is it going to really work, or are things going to get worse? What would be your
mimi naweza sema tu juu sasa tuko na devolution is here with us. Na ni Wakenya tu walipitishanga katiba na tukasema ni hivyo. Mimi naweza sema tu, I think we need to apply there's something I note also. I don't know if it's a Kenyan psyche, ama ni too, sometimes I note, is that in most of our communication yetu zenye si ufanya, people talk about we have good communication skills, but rarely do people talk about a feedback mechanism. So ndani hiyo communication plan, kila kitu inaonanga what, and I might also add that I have maybe a background in communication. Ndani hizo vitu zote, mimi sijaiona kama as a country tushai applying feedback. Na in Kenya also feedback, hiyo software yetu ya ku appreciate feedback, ni kama unaona, like for example, ukipeana feedback, even you see it with the political leaders, inazanga kukanika attack. For example, watu wa government, Kenyans wakisema SHA is not working. Your average in an ideal world, mtu anafaa kusema like what are the hitches. Unasikia ni unafaa kupeana juu idea nani ili what uto to hitches. If it is, unajua ugonjwa aigojeangi. Vitu za health ni vitu very urgent. Juu I'm telling you, well, sina hiyo facts sana lakini nasikianga life ya mtu ana bleed inafaa kusaviwa in maximum like 30 minutes. As in zile initial like ile first aid and how that person has been handled is the initial 30 minutes zina determine sasa hizo vitu zingine zitaongea baadaye. So I'm imagining mzee amefaint before muulize kama ako na shisha, psychology ya kwanza inafaa ku preserve life. Because sasa nikao unasema wewe tumekunyima nini jua una sha. But I find that problematic because mtu ako na highest attainable standards of health na ni right yake ku access health. So kwanza apone, we have also seen very indignifying stories around watu wamedetainwa hospitali. Hizo tunasikianga bado ati mama amezaa mtoto. Mtoto sijui akojafika miezi. Mtoto amedetainwa, mama amedetainwa. So in that same health facility kuna mtu mwenye ako Kenyatta lakini si mgonjwa. But they don't know there are women in Kenyatta maternity wings who are not unwell. Ati ni kugojea mtoto. So najiuliza hiyo space, unajua sasa lazima innovation pay respond to these issues. How else hiyo ni manpower ime relax tu ako tu ati na, you know, those are funny stories.
The reason as to why at times it becomes a challenge is because when wengine inakuwa ngumu ye aende home because hana kama transport ya kuja kuangalia mtoto on a daily basis, so ana prefer akae hosi. Wengine
again there's the NBU unit, the newborn care unit. So, you know, a mother has to be there to feed the baby. In as much as mtoto baby pengine amekuwa kwa incubator, you'll also need to express milk na feed. So that's also forms part of the reason as to why wanakuwa hosina.
Like yeah, me when I gave birth, I had such a similar issue. I was discharged, but my baby remained in the hospital. So it's even difficult to process. So I'm going home, I'm leaving my child, I need her to breastfeed, I need to do kamua maziwa. So will I be kamuaring from home, running back to the hospital? Ama do I have to stay in the hospital? But you see again, even as we are thinking about all these things, maybe we can have something just can be done.
There's a hospital in Kijabe. So in that hospital in Kijabe, they are known very well to do corrective surgeries for disabled kids. I think they had an innovation where they had some form of like a hotel something, and it has income generating aspect, like some of them are rented out. So mama wanakanga huko wakigojea watoto kusave ile kitanda space yenye angelala juu yeye si mgonjwa. What I'm saying is that due to constrained, we have now to start dealing with these things pragmatically. But anyway, maybe you've asked me, should health go back to national government au baki kwa devolution kwa whatever. Me I can just say it's just a matter of priorities. Because in that same counties zenye unasikianga wakisema hawana madawa za madaktari, you also hear high level corruption and budgeted corruption cases of millions of shillings. So mimi naweza sema let us just have priorities, right? And we have to make sure that Kenyans are not getting sick funny. I remember in the finance bill that was done by Nairobi County government, and how I know, sijui kani hii yenye imepita ama ni ile 2023, I have some friends who are youth activists. Walikuwa wanasema ku 6 family planning ama vitu zinahusu reproductive health care ilikuwa free, lakini kwa ile proposed ilikuwa imewekwa 500. Wakafanya activism, wakafanya activism ikatolewa. So your proposal ikatolewa. What I'm saying is that we have to always try as much as possible not to make our healthcare to be a barrier for the youth to come and seek reproductive healthcare. Make it more welcoming by making it free, and then I'll try and bombard them with health information hadi wa change. You know, like first make sure that they are coming to you. Ukishafika hapo sasa partner with people like tuwajibike mtaani project ya yenu Vision Changers. Nikiumwa na kichwa asifai kulala siku mbili ngigojea iende chini juu ya kuogopa bills. It has to be meant that najipresent kwa hospitali, maybe kuna break ya kuumwa na kichwa in my community. That's why ugonjwa zetu huwa tunazidetect late because people fear poor health seeking behavior, but the biggest barrier inakuanga cost and maybe the attitude of health personnel. Maybe just my final remarks on the subject, also like the gender sensitivities around it. In Kenya inakuanga tu, it's chaotic everywhere. You had people whose bodies are being detained even in mortuaries. You know, ateseka ukiwa mgonjwa ku hai na watu a lot of money is required.
I've never understood that bit about holding someone's body Like they're already gone.
Familia yao ati iliinka, so uliinka expense kwa uhai. So I think there are so many issues. My view is just that we need to stop politicizing the process. We need to put dignity at the heart of public health care.
Okay, thank you so much, Wanja. And over to you, Arthur. Maybe you could give us your closing remarks. Yeah.
Yeah, on the question of should the health be taken back to the national government or county, or it remains at the county level, I would also share the same opinion. It's a matter of priority. If we can prioritize health issues at the county level, all will be well. And in Nairobi County, I'm not like siding with the governor. Nairobi City County, as opposed to other counties, at least the governor has tried to ensure that there's dignity, there's order, and also opportunity. Like last year, I think the county government of Nairobi employed more than over 1,000 healthcare workers.
Okay, so according to WHO, one doctor is supposed to be attending to 1,000 patients. In Kenya, the statistics are 1 is to 5,000 thereabouts, or over 5,000. So with that, which you've said about the county government being able to employ new healthcare workers, are they almost closing the gap? Have they closed the gap in Nairobi? Do we expect better services now that you're saying that healthcare workers have been employed in Nairobi County?
I must say that there's still a gap. There's still a very big gap, and maybe perhaps as she said, it's about a matter of resources. Maybe perhaps the county government are not given enough resources to employ more healthcare workers, or alternatively, the county government can prioritize health issues so that they push for more resources into the healthcare system as opposed to other departments.
So during budgeting processes, that there would be more increments in terms of budget towards the health sector. Yeah. Oh, okay. Sawa. Thank you so much for the conversation, for the thoughts, and for sharing your ideas and even recommendations in terms of us ensuring that we are closing these gaps in service delivery, specifically in the health sector. I am very grateful for your time and your resources also, to just see that you are bringing very live examples of what is happening across the country, and to just see that our country is moving forward. Thank you so much for your time, and we look forward to furthering this conversation more and more in the days to come, and to also making Kenya a better country for each and every one of us. Let's all remember that human rights are not for any specific person. Even as you attend to people in your area of work, accord people the dignity and respect they deserve. Same to us, even as we do our activism work, even as we are part of the non-profit organizations and the civil society organizations. Let's always champion for the protection of human rights. Thank you so much, Arthur, for joining us, Public Health Officer at Kariobangi Northward, and also Wanja Maina from the Hummingbird Grassroots Center. You can follow Wanja at X at Wanja AH. So Wanja, her name, then AH at the end. We are grateful to you also, our viewer and listener, for joining this conversation today. Please feel free to also give us your feedback in terms of comments, likes, and viewership, and also share with other people in your networks to join this conversation as well. So as we close this episode today, I just want to encourage each and every one of us to continue visiting these public health centers. Please, I understand that some of us go to private entities, but please consider the public health centers. They are functional, as we've had the public officer talk about. And for us to continue rallying for service delivery, it's important for us to also get those services. So if you're not going to that public facility, who else is going? So ensure that you go. And if you have any challenge, feel free to actually give feedback to our public health sector to ensure that we're bettering services. Till next time, my good name is Joy, and I look forward to the next conversation. Bye.